my name is Brianna Contreras, and I'm Associate Editor of Managed Healthcare Executive.
Hi, my name is Peter Werwine, and I am Senior Editor of Managed Healthcare Executive.
We are very excited to be sharing a video spotlighting individuals selected for Managed Healthcare Executives' annual 10 Emerging Industry Leaders in Healthcare feature. This is our 4th annual feature, which is shared in our October 2020 issue. We ID candidates by nomination and independent research to identify 30 finalists, and then we window that list down to 10.
And the criteria we use for both the finalists and our final 10 is we look for people who have launched some key initiative, who have had an impact on healthcare, who have taken on increased responsibilities both in their current position and maybe in some past positions. In short, we look for leaders. And then to satisfy the emerging part of 10 emerging healthcare industry leaders, we limit our list to people who have worked in the industry, to folks who have been in it for no more than 15 years.
This is one of our favorite features of the year, where we meet great people to speak with and who belong to a range of fields in healthcare. We hope you enjoy the short video.
I've always been inspired to help others and to have an impact, and that led me to medicine and continues to connect to various aspects of my work. I've served my country in the US Navy, deployed to Afghanistan. I've advocated for and built programs to promote LGBTQ health and equity. My research is centered around information technology and how it can improve patient safety and outcomes and health equity. And my efforts in those areas continue at the AMA, the American Medical Association, as well. Now here at the Advancing a Healthier Wisconsin Endowment, I'm fortunate to guide how we, as a $450 million statewide health philanthropy, can shape and support efforts to substantially improve the health of our communities. COVID-19 has changed nearly every aspect of our work. As a statewide health funder, we immediately knew that the endowment was uniquely positioned to respond. And we shifted our grant infrastructure towards a rapid response opportunity, reducing our typical funding timelines, usually 6 months to a year to deploy funds. We got that down to 3 weeks. And in early April, I was thrilled to announce $4.8 million to fund 17 Wisconsin-based initiatives that have supported prevention, risk reduction, and minimizing the transmission of COVID-19, efforts that we know today save lives. And at the AMA, we've continued to respond to the urgent needs of physicians on the front line by doing a number of things, advocating for resources like protective equipment, supplies, and testing equipment, and by providing trusted evidence-based information and fast-tracking the kinds of tools and resources that are needed to sustain physician practices across the country. You know, racism is a public health crisis, and to do our part in healthcare and in health philanthropy, we have to recognizing that advancing health equity has to be at the center of all of our work. And at the endowment, we have started the hard, often uncomfortable work of defining how we can change our internal processes and structures to remove barriers and improve diversity in who we are and who we invest in. And at the American Medical Association, we've recognized racism as an urgent threat to public health, the advancement of health equity, and a barrier to excellence in the delivery of medical care across the country. And to that end, we're actively working to dismantle racism and discriminatory policies and practices across all of healthcare. I really enjoyed during this era of social distancing and more time at home, spending time with my husband and our 17-month-old son, Ethan, and working on my baking recipes, particularly my signature challah, which is getting pretty good.